Hello everyone, I am Dr. P.R. Gupta, consultant physician and diabetologist. Today I am going to talk about the diabetes, its type, risk factors and other diseases associated with diabetes, and nonetheless the treatment protocol, maintenance protocol for diabetes. Before we start, we all know that diabetes is a growing challenge in India with estimated 8.7% diabetic population in the age group of 20 and 70 years. Younger age group and older age group both are affected in India. The India is known to be the diabetic capital of the world with as many as 50 million people are suffering from only type 2 diabetes. So what is diabetes? Diabetes is a chronic disease associated with abnormally high level of blood sugar or glucose in the blood. Generally, the fasting blood sugar for the first time equal or more than 126 milligram per cent, and postprandial, that is 2 hours after food, blood glucose is higher than 200 milligram per cent plus minus symptoms, or and HbA1c equal or more than 6.5% are supposed to be a diagnostic criteria for diabetes type 2. Now, what are the types? Mainly 3 types, though there are many other types, but commonly type 1, type 2 and gestational diabetes mellitus. This type, gestational diabetes mellitus, occurs in the pregnancy. There is another one which is known as LADA, latent autoimmune diabetes, which appears in the younger age group or in the adult age group, and there is immunity behind it. Why diabetes occurs? Whatever food we eat to stay fit and healthy is supposed to provide the energy in our body. For that, first it is digested by our digestive system with the help of enzymes, and it breaks into glucose and fructose. Then by the help of insulin, which is a hormone from the pancreas, this glucose and fructose enters inside the cell where it produces energy. In diabetes, what happens? There is an absolute lack of insulin hormone, or insulin hormone is there but there is resistance in the insulin hormone, so insulin hormone does not work properly. This is why the glucose and fructose cannot enter the cell, stay in the blood, thus causing high blood sugar and causing different complications in the long run. Now we will see the types individually. Type 1 diabetes. Type 1 is also known as juvenile diabetes or insulin dependent, though the terms many a times are misnomer, still we use colloquially the insulin dependent juvenile in this way. It is a chronic condition where pancreas cannot produce any insulin. Without insulin, these patients will not succumb. Type 2, also known as non-insulin dependent diabetes. Again, the term may be misnomer, because type 2 diabetes also requires insulin after 8 to 10 hours. Here is insulin present, but there is a resistance to the insulin secretion. So, the amount necessary to enter the cell and giving the energy for our health doesn't occur. They stay in the blood, high blood sugar level occurs, and they ultimately, if remain uncontrolled, give rise to several complications. Gestational diabetes. In the time of pregnancy, especially in 24 to 28 weeks, there is a lot of hormonal imbalance from the placenta, which is a connector between the mother and baby. Several hormones are released along with steroid more secretion and other hormones, which causes high blood sugar, which usually after delivery become normal.